And all right, again, welcome to the MAC portion of annual training today. Again, my name is Olga Ginchin, the School Health Services Administrator for the department. We also have from PCG today, John Ward, Rose Jensen, Lori Bob, Andrew Jelinski, Jennifer Pham, Matthew Gillis, and from the Colorado Department of Education, we have Omar Estrada. And in addition to myself from the department, we also have Tracy Gonzalez. Also just want to welcome everyone who's participating from across the state. So thank you for being here. And I think that's it for all of the housekeeping stuff. So I will pass it over to Matt from PCG.
All right, thanks, good morning. Hi, thanks, Olga. Good afternoon, everyone. Like Olga said, we are going to be getting into the Medicaid administrative claiming portion of the training for today. We will just start off. We're going to go through some MAC features. We're going to look at a claiming system demonstration. We have an activity for you all to do, which we'll do breakout rooms for. And then we'll just wrap everything up with some contact information and then question and answer time at the end. So just to start off, we have this large list of acronyms. I will try to make sure I talk in acronyms as little as possible. There are a lot in these sections, but at the beginning of the PowerPoint, there is a list of all of them that will be referenced in the slides. And then we also have these Medicaid and schools portions in these slides. These were covered during our RMTS portion of the trainings. So more detail on those will be within those trainings that we just did. All right, so now we will get into MAC, which is Medicaid and Administrative Claiming. So our first slide here just shows us everything we have done in claiming for reimbursement for the past 5 fiscal years. So as you can see, the bottom key has JS, OD, JM, and AJ. That's referring to the quarters. Dark blue is going to be July through September. The lighter blue is going to be October to December. Yellow is going to be January through March, and purple pinkish is going to be April through June. So this just shows you that we have actually been increasing our MAC reimbursement through the fiscal years. Throughout the pandemic, we have been claiming more and more statewide net reimbursement, regardless of everything going on. Each of these quarters, you can see we have pretty much been increasing. You can see in our current fiscal year, there are actually only 3 of those colors. You all just entered in your April through June costs for us, which means that April through June claiming will start for MAC in the coming months. So that's something to keep an eye out for notification wise. But we're actually about 11,000 above where we were in our statewide reimbursement as of right now, compared to fiscal year 20 and 21. So we are actually on par to meet or exceed last year's reimbursement as well. So just something good to note. And then we're going to actually get into some of the claim calculations and variables that go into building that reimbursement that I showed you at the beginning. So the first 2 we're going to talk about is the Medicaid enrollment rate and then the unrestricted indirect cost rate. So the acronyms for those are the MER and the UICR. But for the Medicaid enrollment rate, it is going to be the ratio of Medicaid enrolled students that you have each at your own district. The graph here we have shows our statewide averages for the past 5 fiscal years. So once again, in association with that reimbursement graph we showed at the beginning, you can see that the Medicaid enrollment rate throughout the past 3 years, so throughout the pandemic, has actually continued to rise. That is good news, but as we have seen, that is also due to the state of emergency that was going on. We weren't taking students off of the Medicaid list for Medicaid eligibility, excuse me. So that percentage has continued to rise. Once we do start to take those off, we don't know how that percentage will change. given that we have added students. We don't know how many are going to have to be taken off. So this could be a percentage that fluctuates, and as it is a variable in your Medicaid claiming, it could slightly affect our reimbursement in the next fiscal year, but we don't have any idea for sure. Just something to make sure you're aware of. If you have questions on, you can feel free to reach out to us. And then the other variable we have up here is the UICR, which is the unrestricted indirect cost rate. And this is just going to be a overhead rate determined for your district, handed down from the state. And it's just going to be an overhead bump that gets added into your claim. And you can also see that this has relatively stayed consistent throughout the past 5 fiscal years. So it doesn't greatly affect your claim due to the fact that it doesn't change, but it is important to know because it does give these claims a little bit of a bump. And now that we have a little bit of better understanding of 2 of the variables that go into these claim calculations, we'll take a look. We have about a 5-step here, with the 6th step being the total reimbursement, just to give you guys clarification on what goes on when these quarterly claims are calculated for you. So our step 1 is going to be taking everything that you just did for the April-June quarter, and that's all the salaries, benefits, contracted costs, all that good stuff that you put in for us for that quarterly cost. That's going to be rolled up and become your cost base for your district. So once we have all those numbers from you verified and in, we start the claim. We then will take the quarterly statewide average MAC percentage. So these percentages I'll go into in more detail in the claiming system because it's a little easier to show what that looks like. But we take these percentages, multiply it by the district cost base. We then take the Medicaid enrollment rate, which we just talked about on the last slide, for your district, multiply that in. We then add in the UICR, which is the unrestricted indirect costs, which will be just overhead costs that provides a little bump to your claim. We then multiply it by the federal financial participation rate, which is the FFP, and that's always going to be 50%. And once we do and work through all that fun math, we then get your MAC reimbursement for the quarter. So a little bit to look at before we actually get into our claiming system demo is just what the claiming system is there for. So it's really there to help you all easily report costs, which helps us then for the quarterly claim. But there's a lot that goes into making sure those costs are appropriately allocated. And one of those things is making sure that your staff pool list is up to date. Because the claiming system pre-populates from that staff pool list that you do once the quarter opens for that, we then will ask you for those quarterly submission of costs related to the staff pool list members that you had on there. So it's just important to make sure that we have these 5 categories listed here: the first name, last name, job category, cost pool, district job title, and job span, just so we have all that information on the claiming site. And it's up to date. So when we do come and ask you at the beginning of submission for quarterly costs, we're asking you for all the right information, and there aren't staff pool list members that aren't actually with your district anymore. And another thing to make sure that you know is that for MAC, we do utilize cash basis accounting methodology. So this really just means we will ask you to report costs for when they're paid, not from when the time they're accrued within. We use a different accounting methodology for the annual side, but for MAC over here, we use cash basis. And for an example of that, it's just going to be mainly with contracted staff is where this comes up, is if you have someone contracted that does services for you in September, but because their service weren't finished until the end of September, they don't get invoiced until October, and a check doesn't actually get cut until October, we would ask you to report those costs in October because that's when the actual cash left your hand. So that is the methodology that we use for MAC, and then a little more information on the claiming system. And then one thing we're going to talk about in further detail on the claiming system demonstration as well is certification of public expenditure forms, also commonly referred to as CPE forms. And it's important that we do these after every claim. And there's a few steps to make sure that we go through and do in the right order, just to make sure our CPE form is all up to date. It's important that we have a source fund assigned for all expenditures reported for the quarter. So this is just to make sure that those expenditures that you all reported when we opened the quarter for costs don't have any federal funds included in them. So that's the primary reason for doing this funding section. But like I said, we'll have a demonstration where we actually go through all these steps and show you what the proper process is. But after assigning these source funds, there are 3 steps that you all have to do. Is you have to print it off, sign it by a correct representative. So that's either a CEO, a CFO, or a superintendent, someone that can verify the expenditures and sign off on the claim. And then you will then, after signing it in pen, scan and upload the signed document back to the claiming site. And so now we will actually go into the claiming site just to do an example to show you all a couple of key features that we felt is helpful and go through everything. So hopefully now you can share or see my shared screen of the claiming site. Please feel free to stop me if you all cannot see this right now. But this is what it will look like when you log into your claiming system. And so just a couple things to note right here on the home page is this message at the top. We'll try and keep this updated with short and to the point messages of upcoming due dates, things to keep in mind, just for you all to reference, given that there's a lot that goes on at one time. So we'll try and keep this up to date with what you should be looking forward to complete within the few weeks. Then another important thing on this homepage, if you scroll down just a little, is going to be this resources section here. We will upload a lot of program manuals and PowerPoints, stuff from trainings, recordings, all under this resources section. So if you ever have any questions, want to reference something before reaching out to us, you can come check this resources section. There is a lot of good resources here for you all to be able to reference and use whenever you would like. And then just at the bottom, we have our phone numbers to call if you have questions, and then the various emails that you can reach out to based on what your question is going to be. So now that we are done with the homepage, just an important thing to note when entering in any staff pool list members or costs is this top right here is making sure that the fiscal year, the FY, and then the quarter are up to date for what you want to be entering information in for. So this is going to constantly change based on what month we're in. It will then update the quarter. So we're in August right now, which means that we're within the July-September quarter. So whenever you log in or the site refreshes, it will auto-populate this to the fiscal year 23 and then the quarter July-September. Just important to note if you are entering in financials, staff pool list members, trying to update stuff, and you run into any errors, it's just important to check up here because this will sometimes be the root of that. So I'm going to change the quarter to look at our mock data for the CPE forms. So we're going to go and look at CPE forms. So when we go and look in here, we're going to see that it shows us a place to upload, to download, list our expenditures. But the important reason I came here first, and instead of going to funds, which is where we're supposed to go before the CPE form, is this source section is going to be blank until we put a source for funds on the site. And this is important because we do not want this written in pen. The only thing wet on this form should be the signature down at the bottom. The rest of this is supposed to be generated by the system. And this source section comes from you putting in the correct funding location for the expenditures for the quarter. So it's important to do the funds section first before going to print this off. So now that you've seen what it looks like before we go, we should go into funds first. Make sure this quarter is correct up at the top. And then what you'll see here is your funds for the quarter that, or excuse me, your expenditures for the quarter that you listed will be right here. What we're asking is you to go double check, make sure those expenditures are correct, but also that none of those contain federal funds. If that is the case and there's no federal funds, we'll ask you to add a fund based on where those came from. So a lot of districts will do this where they just have one general fund. But as you saw with the CPE form beforehand, there are multiple lines. So if you do want to add in multiple funds because that's how you use it, feel free to. You just have to make sure they add up to the expenditure amount that we have listed for the quarter. And then if we do one general fund, which we'll do for this example, there are a couple of things that this box doesn't like. You can see it's giving me a warning now, invalid dollar amount. That just has to do with this comma. So when you're entering in amounts here, just make sure you don't do any commas or any dollar signs. But as we do ask you to be specific, if you have any one general fund or multiple, the period for the cents can go in, and that is totally fine, but just no dollar signs or commas. So I'm now gonna click create new fund, and you can see it updates here with what I typed in and the exact amount I typed in. So now that we finished our sourcing of funds, we'll go back and look at the CPE form and see how it changed. So everything at the top is the same, but you can see here it auto-populated based on when we put the sourcing for funds in. And then just as another note, your total expenditures line item is here again. If you do put one or multiple sources, just make sure this adds up to what your total expenditures were for non-federal funds, because this shouldn't include any. And then another thing to note is up here, when you're printing it off, it'll show you what quarter you're printing off for. As this may change, it's important to make sure that you're printing off the CPE form for the correct reporting period. I know towards the end of the school year in the April, March months, we have a couple claims that go back to back. So this is something just to double check for, make sure you're printing off the right one. Another thing to note is just to double check after you upload the signed form. A lot of the time, the same person is downloading the blank one, signing it, and then uploading the signed one, just to make sure that you upload the correct one after you've signed it. If you could check after the fact, that would be great. And if you do realize you uploaded the wrong one, feel free to use the help desk, the emails at the bottom, reach out and let us know, because we are able to roll back the CPE form so you can re-upload the correct one. But instead of waiting until the end to have us find out and reach out to you, then if you let us know, we can get it rolled back and you can upload it when you have a chance instead of it being at the last minute. So that is all on CPE forms, but a couple of other things on the claiming system that we wanted to show you that we felt was helpful. Another one is quarterly and then quarterly summary. So there's nothing here on the quarterly side that we will actually ask you to do with this location, but it is a helpful spot to go check, whether for internal or QCing or whatever you may use it for, but it does break down everything that you entered cost-wise for the quarter that you are in by service type. If you click on it, it also shows you your job categories that you have, staff count, all the costs that you have entered. So just a good place to go reference. If you ever have questions, you can reference this location as it breaks everything down. And yeah, just a helpful location for you all. Nothing we'll ever ask you to do in this quarterly financially summary section, but just something to be helpful. And then one other section of the claiming site that we felt is helpful for you is this quarterly and then claim summary location. So this is where you can find the full calculation and those variables that we talked about in the previous slides. This will actually break down the claim so you can see your UICR, which is your indirect costs, It's going to be here. It's how it's put in. The FFP rate, which will always be 50, is here. The state cost percentage, which is 2.5%, will be here. And so this is just a mock claim to show you where this breakdown will be. There's also each cost pool we break down the claim. So I'll look at each. The admin and the direct service are going to both look the same with a change in the activity percentages because it's the different cost pool, but the information there is all still going to be the same layout. And so we'll actually look at this admin cost pool summary for your claim just to break down each of these headers so you can all understand what you're looking at if you do choose to go and look here for your claim. So this first column is going to be all the codes associated with the moments that were sampled. This activity percentages here was step 3 in the formula. And this activity percentages is going to be from the time study statewide, what each of these broken down to average was. So this isn't going to be your district activity percentages. So our example here is Colorado Demo District 1. They didn't have 37% of their moments as code 3. They is going to be the state. So they did contribute because they were sampled for the time study, but this is not going to be your district specific activity percentages. This will be statewide. But this column here, cost pool dollars, is going to be all the costs that you reported for the quarter for that cost pool. You can see here for direct service, it's going to change because it is broken out by cost pool, but these will be the cost pool dollars that you entered in when we opened up quarterly costs. Medicaid eligibility rate is going to also be with your district. You can see here some are 100%, some are 45%. It's just determined based on the time study implementation guide, which code gets which Medicaid enrollment percentage. But if it's not 100%, it will be your district specific percentage. So for this example, for this district, their Medicaid enrollment rate is 45%. So for those codes that it wasn't 100%, they got their MER applied, which was 45%. And then the rest of these are just going to be going through the math of calculating the claim and then getting down to the total number. So that was the claiming site. As you can see here, activity percentages will change for direct service just based on the cost pool, but all the headers are going to be the same, and the application of statewide versus district specific will also be the same based on cost pool. And if there are no questions on the claiming site, I am going to switch back to the PowerPoint and finish up the last couple of slides before we get into an activity. And then just a couple things to note with the beginning of the year, just some housekeeping items to keep in mind when we're going in to start the actual school year. The first is just making sure that users' accesses in the claiming system are correct. So if you could take some time, go in, identify the access level of all the district users you have on the claiming site, and then make note if their roles or access needs to be updated. There are actually 3 different levels of users in the claiming system that I'm going to go over in the next slide, but we'll be able to make note if you want someone to have more or less access. Feel free, as in step number 2 says, just contact PCG with the request for changes, and we'll be able to go in there, make those changes, and make sure that your claiming system looks up to date for the school year. And another thing to note is, as we know, people are getting new members to their team, is making sure that those users are added if they are access the claiming site. So making sure that they're in there, we'll make sure that we get all of our emails out to the right people, but all we need to add them once they're approved to be in the claiming site is their name, their email address, and their district title. Once you reach out to PCG with that information, requesting a new user for the claiming site, we will then get them set up, send them an email They'll just have to watch some videos to make sure that they understand the claiming site, and then they will be all set and able to go in and do some of those things just like I show you, but it is based on what their user access is. And so there, like I said, there are 3 levels to user access, but one thing we want to make sure we note is that it's important that there are active financial users for your district on the claiming system. Like I said, there are videos for new users, but it's important to make sure we have new and active users, not necessarily new, excuse me, but active users and not outdated emails or people on for their financial users, because that's who we'll be reaching out for when quarterly costs open. CP forms need to be signed. So it's important to make sure the right people are getting those emails. There's no delay in claims because there wasn't someone that wasn't actually getting the emails from your district. And so the 3 levels of access we have are listed below. There's admin, editor, and viewer. They each have their own benefits, their own things they can do. The admin has access to certify, edit, and view district financials. It's just important to note that these should be people who you actually want to have the power to certify these types of things. So typically it's going to be a CFO, a director of finance, a business manager, superintendent, someone that has that level of knowledge and understanding to be able to certify. Definitely does not have to be those people, but someone of that same level for an admin user. The next is going to be editor. So these would be people who wouldn't necessarily have the level to certify, but can go in there and edit, view district financials, enter in costs. Someone that would be able to go in there and do that for you, but not have the last sign off on it. And then finally, we have our viewers. Those are just people who are able to view the district financials. So view some of those sections that I showed you, not actually entered in anything for them, but be able to see what's going on in your district specific claiming system. And now we're going to break out for an activity, but before we actually break out, I wanted to show you what, so you have a visual. So we're going to give you a word bank, and then we are going to ask you to apply those words to a Venn diagram. So we're going to ask whether they apply specifically to the annual side, the MAC side, or both. In our rooms, we'll go through these and talk through them.
I think we're good.
All right, so we actually had a question in our group, but before we get into questions, I am just going to show you all our program resources where you can reach out to all of us, good references for you guys to have. So just the claiming site, the actual school health services program site. We have all of our contact info listed here for the department, CDE, which is Omar, and then our various support venues through PCG. So I will leave this up for you to reference, and I am going to see, so it was in our breakout group, I'm just going to take it, Christina had asked a question on how the direct service cost pool comes into play in MAC, and how you know, if they're direct service, how they're doing administrative tasks, and we're able to actually claim for it. So, I mean, the rough overview, which Rose then will jump in with more detail, is a lot of these providers do administrative tasks, whether it's outreach or some of the various items that they do that may not actually be within their direct service scope, but they do those as part of their regular activities. And since they're doing those, we're able to apply those through MAC and claim for them as well, because they are doing those services. But Rose, feel free to jump in if there's more to apply.
Yeah, I think you explained that very well, Matt. That's exactly what I would say. When we showed you the RMTS session, in the RMTS session, the reimbursable percentages, you'll notice that the direct service providers you do get a reimbursement for their MAC activities or their administration activities, or like, as we think of them, outreach and coordination type of activities. So even though they are mostly doing direct service, working directly with kids, they're also coordinating services, sitting in on IEP meetings, talking about the needs and things of kids, writing the IEPs and other plans of care and things like that. And so some of those services that are supporting direct services are reimbursable even for direct service providers, not just admin folks. So just really elaborating on what you said, Matt.
Yep, and I thought that was a really good question. So instead of answering in a small group, figured I'd bring it here in case we had other questions. But that's all we have for the presentation. So feel free, ask any other questions, use the raise hand function and come off mute to ask as well. But we'll be here to answer these questions.
Can we see the diaphragm again of what you had up before this?
The Venn diagram.
Yes. Thank you.
And these will come out in the newsletter as well, with which category they should be associated with. So you will have this to reference besides from the slide.